Knees are super, super easy to fix. They are hinge joints. It's not really designed for rotation. When it does rotate, it tends to wrinkle the meniscus. Most people injure their knee doing what? Rotating, right? So they plant their leg and they go somewhere. They plant their leg and they go somewhere. That rotation should happen at the hip, but if their hips are tight, guess who gets to do all the motion? Their knee. What does swelling usually mean in the knee? Swelling always means meniscus. Always. If you ever see swelling in a knee, it's meniscus. So what meniscus feels like is it's a little tiny worm sticking out of the joint. So when you check on either side of your joint, sometimes you'll feel a little lump, 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 lump. That lump, lump's not supposed to be there. That's that little worm. It's called meniscus, and it's sticking out. Now, meniscus is like a tablecloth. And it's actually thicker than a tablecloth, but that's a good analogy for it. It goes between the two bones, and when the bones don't move right, it wrinkles. You ever have someone say, my knee feels like it's going to give out on me. I don't trust it on the stairs. Okay? What that is that's the meniscus between the two bones wrinkled a little bit, and when it gets compressed, the body goes, oh, don't tear that, and it takes all the weight off of. That's what that feeling is, okay? So that's what that is when somebody's like, oh, it's not like their muscles are weak. It's just that their muscles got the instantaneous message from that joint, don't squish me, I'm bent over, I'm wrinkled, okay? So as you flatten out that meniscus, that will instantaneously go away. And that was the fun I got to have 2 days ago with my patient. So fun. And then I got to see his son, and his son was like, man, you fixed Dad's knee. I'm like, oh, I love that. All right. So super easy to fix. So she just has just a tiny, tiny little thing. So I'm going to assume it's externally rotated, and I know for sure I need to pull it apart. I need to pull it apart because usually it's squished and twisted. So as I untwist it, I'm also going to pull it apart because it's not fun to squish it more. It wrinkles it the other way. So because we know she's slightly externally rotated on her tibia, I'm going to grab her tibia and I'm going to grab her femur, and I'm just going to do this. And she'll tell you that's not very much pressure. It doesn't hurt at all. And drop straight down. It's really, really easy. And I always say it doesn't hurt at all. No. And usually the response I get is, that's it. And I go, yeah, that's it. Because the moment she gets up and walks around, her knee is going to feel way looser and way more motion. The moment she gets up, this is why this adjustment is always my most requested adjustment. So you're going to pull the knee apart just a little bit and rotate it. So I'm pulling it apart, although this foam roll, because it's round, is actually already tractioning her leg apart. Do we get that? So it's tractioning her leg apart. I'm pushing kind of down, but mostly rotation. And we do it, I don't know, 5 or 6 times. And then I recheck her IT band. The IT band will immediately relax when we get the knee where it wants to be. Instantaneously relax, which is really fun because it tells you, yeah, you're there. Most of the meniscus is back in, but the move that actually pulls the meniscus back in is the next move. Just like I said with the hip, there's 2 moves for the knee and 2 moves for the hip. And you kind of have to do both. There it goes. So now she'll say IT band's way looser. Oh, again, you always let them know it's the table making the noise, not your knee. I have made that mistake a few times, and it's just amazing the responses you get from patients. They're like, wow! I'm like, sorry, my bad. And I always try to keep my hands in the same area because I want her to feel that tenderness there, and then after I adjust it a few times, to feel that tenderness being less. Okay, so we kind of want that if at all possible. It's not always possible, but I try to put my finger on that spot. We're going to do a few of these. And so you'll notice how I trade fingers and I make sure one finger stays in kind of the same area. Yeah, that should already be less tender. Mm-hmm. And now feel her IT band. I have not done the pull yet, but feel her IT band. So again, I'm going to put my hand between the two. I'm going to grab her, nice reflexes, all right. I'm going to grab her tibia. I'm just going to traction down. So now I'm already creating space between the two bones. I'm just going to drop straight down. And yes, we could do a long axis traction instead. This is just a much more controlled motion. And since I'm already here and it feels really good to the patients and they're already comfortable with this.
You're isolating the knee.
Yeah, I'm isolating the knee, exactly. Okay, so stand up and walk around. Tell me how your knee feels. It's going to feel lighter, looser, all that kind of stuff.
Oh yeah, it definitely feels lighter.
Way lighter, right? Yeah. It's almost like your leg's like, whoa, I don't know what to do with this. Whoa, like it's crazy lighter, right? Yeah. Okay, now we got to keep it there, yeah? Lay on your back. Because you guys all know that our adjustments are temporary. But they are. Because she's going to go right back to whatever habits and her muscles that got it there and all that.
Patience.
I know, jeez. All right, rolled up towel, regular towel. Knee underneath towel. You guys have pictures of this one already. This is the initial. So the picture you have for the knee exercises, the first one is the rehab that you start with for the first few weeks until the knee pain's basically gone. And then you can do the second one, which is the more advancement of the first one. Okay, and all I do is this. I say, Bonnie, all I want you to do is just press down and squish that towel with your knee. Nice job, and relax. Press down, squish that towel with your knee. Good, a little harder. Okay. Did anybody feel that this inside knee muscle did not hardly turn on at all? Yeah. Almost at all. Yeah. And on this side, it engaged really well, yeah? You guys feel that? It's not because the towel's under it, I promise. We could, if you want, I could take the towel out and we can do it all again. So she needs to rehab her VMO because it's totally on vacation. That's why her IT band gets so tight, because when there's nobody to stabilize this side, the IT band feels like his job is to stabilize the whole knee. So you got this guy who attaches way up here, stabilizing something way down here because this guy is not just hugging the knee like he's supposed to, okay? So she needs to rehabilitate this inside knee muscle, or you're gonna be adjusting her knee every week for a very, very long time, okay? So all you're going to do, Bonnie, is I just want you to press down. Think about using this knee muscle and press down that towel. Nice job. Excellent job. And relax. Would I have said anything different had she not pulled it off?
No.
No. I still would have said, nice job. And then I would have changed my words so she did it right the next time. It's always my fault when the patient doesn't do their homework right. Every time. It's always my fault if she doesn't do it right, because it's my job to articulate it in such a way that she gets it, okay? And you keep going until she gets it, which you did beautifully, by the way. So press down for me. Press down and hold. Hold it, hold it, hold it. There you go. Now I'm going to tap this muscle. Why am I doing this? We talked about this early on. It's biofeedback. Exactly.
Wake up.
Exactly. And relax. Tighten again. There you go. You feel it engaging a little bit now. So we woke up her muscle, yay. Your job's to keep it awake, okay? 15 to 20 reps twice every day. You have pictures on your table and everything, okay? And then butt squeezes to stabilize this long lever called the femur so that this doesn't continue to happen again and again. Okay. Questions on that?